America's privately owned freight railroads keep the nation on track, investing $23 billion a year, 6 times more than the average manufacturer, to deliver safe, reliable service. That's how railroads move 59 tons of goods for every American each year and help their customers grow. Railroads do all this while offering some of the safest, best-paying jobs in the country, supporting families and driving the economy forward. Learn more at aar.org/America's Engine.
Quick question. Do people come to you for answers at work? Maybe you're managing projects, training new hires, or just the one everyone relies on. That's leadership. Through UVA Darden's part-time MBA in Roslyn, we help professionals like you turn real-world experience into recognized leadership credentials without stepping away from your career. Whether you work in healthcare, education, government, or business, this is how you take the next step. Learn more at darden.virginia.edu/PTMBA.
If you look around, so much of our lives are designed with prevention in mind. From the seatbelts in our cars to the lids on our coffee cups, we're staying proactive. A strategy that saves a lot of money, time, and frustration.
Can you imagine a world where we don't take fire prevention very seriously? We have structures that aren't built to prevent fires, where we don't have fire alarms, we don't have fire safety in everything that we do. And we see actually the consequences in some places, like what happened in Los Angeles. There was a wildfire, but it spread very rapidly. There was a lot that could have been done, more that could have been done.
That's Dr. Barry Davis, Professor Emeritus of the University of Texas School of Public Health. His new book, The Preventioneers, Diseases, Disasters, and the Discoveries That Changed Our World, highlights the brave people who've pushed against the status quo. While prevention is now baked into so much of our lives, society doesn't often like change, and many of these normalized ideas were once considered taboo or offensive. For example, it took decades after the invention of modern cars before passenger safety was prioritized.
It was just accepted when the cars came out that, the crashes would happen. It was people. They didn't drive right, they weren't paying attention, and so on and so on. But then there were a few doctors who saw the tragedies of these car crashes. It was like a plastic surgeon or an ear, nose, and throat doctor or a neurosurgeon, and they saw the consequences of what was happening. And they realized that there was something wrong with the car because, okay, the car is going to crash, but you're inside the car and something's going to happen to you when that stops. And they came up with all these ideas about seatbelts and padding the dashboard and retractable steering wheels, and eventually airbags, and so on and so on.
Yeah, it was a challenge to convince other doctors to support the movement, and it took years to create public policy around it.
And even after the legislation, which occurred in the 60s, it was quite a while before seatbelts were put in cars, but quite a while before most of the states made them mandatory to use.
There's a running theme with all the major prevention efforts Davis highlights, which is they're almost always met with extreme hesitancy from the public. You may be shocked to hear that one of the more controversial ideas was in the mid-1800s. Hospitals had high rates of maternal mortality due to childbed fever, which is caused by a bacterial infection in the reproductive tract. They couldn't figure out how to prevent the condition, but one doctor suggested it may help if physicians started washing their hands.
Now, nobody knew anything about germ theory back then. They didn't know how infection spread. They didn't really even think so much of infection. And then the prevailing theory was that there was something in the air, it was called miasma, that caused things. And he realized after a while, it took him a long time to realize it, and it sort of came to him as an epiphany, that what was causing it was that doctors were going from the autopsy room where they had examined patients right to examining women who were pregnant. And he realized they were carrying something. And he could smell the autopsy particles on his hands, and he realized that he has to get rid of that smell. And he came up with this chlorine washing.
One hospital instituted this practice and saw an immediate reduction in childbed fever cases. Despite this success, the medical world refused to accept hand washing was the answer.
First resistance was, that was the prevailing theory of the day. What are you talking about, Dr. Semmelweis? The second was, you're telling us that we're not clean? We're physicians. Of course we're clean. The third one was that he was a junior person. He was also a foreigner. He worked in Vienna, but he was from Hungary. And he was telling senior people that this was the solution. And they said, well, you really need to provide more evidence. And he started to provide evidence, and they kept on saying, well, that's nice, but you need to provide more. And they just really wouldn't listen to him. Some people did, but most people didn't.
Dr. Semmelweis died before seeing the impact of his work. It wasn't until years later with the advent of germ theory that people recognized how brilliant he was.
We meet resistance all the time in our everyday lives. If we want to say something, this is not quite right, people say, well, that's the way it's always been, or what proof do you have? And you show proof, and they say, well, that's not really much proof. We need more proof, and so on and so on. And the resistance built up. These people who fought this were fighters, and they found ways to persist and to get their ideas out. Not everyone was successful. Semmelweis was one that was not successful, but the others were.
In his research, Davis realized that it takes a special type of person to create necessary changes in this world.
They see something wrong. They see that something could be done about it. They have to gather enough evidence to convince others. You have to use that evidence to make change or for people to have political will. And then that political will has to be institutionalized somehow so that things will get done.
It takes continued persistence, standing up for your beliefs even as the rest of society fights against it. Despite the initial pushback that often happens with a new idea, many people come around to prevention-first thinking once they realize how it not only benefits society, but it saves everyone money.
It's a lot cheaper to, get checkups, take your medicine, watch your diet, exercise, than at the end have something big go wrong. I mean, everybody sees the thing with the person who has a big heart attack or a stroke and the amount of effort that goes into treating them or fixing them up, and you get that hospital bill, $50,000, $100,000. But you take the blood pressure medicine and you follow it religiously and get it under control, and it's, pennies a day.
But one of the biggest obstacles to creating prevention policy is that the success is invisible. Once a problem is solved, the next generation is quick to forget what life was like before specific programs were put in place. Davis says we can clearly see this cycle happen with vaccines.
People forget what it was like when measles was present all over the population. People forget what it was like when polio was there. People forget when smallpox was there. Now, thank goodness smallpox has been eradicated from the face of the earth. It no longer exists as a disease. But when things are well taken care of, people tend to forget. And we need to remind people constantly about things. We always do that. We need to look to history and remind ourselves of the way things could happen and what we need to do to prevent them from happening again.
Today, Davis says we may be seeing a turning point with social media.
There is a movement that started by Jonathan Haidt called the Anxious Generation, where there's a lot of evidence that this constant access to telephones and social media at a young age is doing something that's not good for the kids.
Davis says there's legitimate pushback from other scientists in the field. They worry that there's not enough evidence to prove it's actually social media that's causing an increase in mental health issues. Davis thinks it's a very similar debate to what we saw when trying to regulate cigarettes.
First of all, there's a huge industry pushback. In the case of smoking, it's the tobacco industry. In the case of this problem, it's the big tech industry. But the other thing is even the science. There was a problem at the beginning with smoking was this causation or was this correlation? Did you just see two things that come together, sort of coincidence, or was one causing the other? And it's the same thing here. And you just have to gather more evidence. But there comes a point at which how much more evidence do you need to gather before you act on it? It just seems strange that you keep on wanting, the goalposts keep moving. You want to keep on getting more and more evidence when you feel that something should be done.
Some countries have already started to take steps towards regulating social media. Australia instituted a ban for teens under 16, and France has a similar law for kids under 15. Other countries like Spain, Brazil, and Greece aren't far behind with their policies.
The warning signs are there. The evidence seems, to my mind, to be there, but I'm very willing to have science talk about it, but just not forever.
His book, The Preventioneers, is available now wherever books are sold. You can find more information about Dr. Barry Davis and all of our guests on our website, ingoodhealthpodcast.org. For more behind the scenes, follow In Good Health Pod on Facebook, Instagram, and X. Our writer-producer is Kristen Farrah. Our production manager is Jason Dickey. I'm Greg Johnson.
America's privately owned freight railroads keep the nation on track, investing $23 billion a year, 6 times more than the average manufacturer, to deliver safe, reliable service. That's how railroads move 59 tons of goods for every American each year and help their customers grow. Railroads do all this while offering some of the safest, best-paying jobs in the country, supporting families and driving the economy forward. Learn more at aar.org/America's Engine.
We know life is busy. That's why saving money should be effortless. With Atlantic Union Bank's Roundup Savings, every time you use your debit card, your purchase rounds up to the nearest dollar and automatically goes into savings. So whether you're grabbing coffee, filling the tank, or picking up groceries, you're saving without even thinking about it. It's just one of the ways Atlantic Union Bank makes managing your money easy. Learn more at atlanticunionbank.com or stop by a branch today. Atlantic Union Bank. Any way you bank.